Good afternoon, my dear friends. We continue our lectures about tuberculosis. Today's topic, treatment of TB patients and prevention of tuberculosis. First part of our lectures, tuberculosis treatment. The main goals of treatment: cure the patients from tuberculosis. Second goal, prevention, death, complications, and other adverse outcomes of the disease. Third, prevention the relapse. And fourth, decrease and stop transmission of the infection from one person to another. What are the main principles of treatment of tuberculosis? First, early and timely beginning of therapy. Next, complex therapy. Next, durable and continuous of therapy. Next, continuity and treatment. Correct diagnostics. Provision with medicines during the process of therapy. Chemotherapy under a standard. Strict control over the drug intake. And last principle, free of charge treatment for patients. And more detail about each principle. Early and timely initiation of therapy allows to isolate the patients and to interpret bacterial contact with other people. Improve significantly the results of treatment and reduce time of the rehabilitation period. Next principle, treatment must be complex. Allows to avoid the development of the resistant tuberculosis. One mycobacterium of tuberculosis is a mutant resistant for 50,000 to at least one of the anti-tubercular drug. 40% of the newly revealed mycobacterium of tuberculosis is resistant to anti-tuberculose drugs. Next principle of treatment, therapy must be long time. If patient get treatment during 3 months, amount of relapses 13%. If treatment during 4 months, amount of relapses 20% of all cases. If treatment duration 5 months, amount of relapses 3%. And if patient get treatment during 6 or 9 months, amount of relapses only 1%. Therefore, the minimum duration of treatment must be 6 months, not less than 6 months. Next principle, continuous therapy. Mycobacterium of tuberculosis divides once in a day, previously in the morning. During this time, capsules are damaged and drugs better penetrate inside of the Mycobacterium of tuberculosis. Therefore, drug intake should be daily. A dose is introduced at the same time, creating maximum concentration in the blood of the patient during the period of division of Mycobacterium of tuberculosis. On this photo, you can see electron microscopy and Mycobacterium divide on two parts. Succession in the treatment. Stages of treatment of the patient. Tuberculosis Health Center. Later, tuberculosis dispensary. And next stage of treatment, tuberculosis sanatorium. Next principle, correct diagnostics. The main diagnostic criterion of tuberculosis is presence of Mycobacterium in patient secretions or biopsy material. It is necessary to diagnose the form of disease, its prevalence, localization, phase of the process, and presence of complications and concomitant diseases. Next principle, standard chemotherapy. Provision with medicines during the whole course of treatment. Patients are treated according to the category they refer to. According to the category, the standard chemotherapy and treatment are assigned. For patients with drug resistance, should a stock of antitubercular drugs should be created for the entire period therapy. Strict monitoring of drugs intake. It is impossible to predict who will be treated honestly or not. Hippocrates said 2000 years ago. The intake of antituberculous drugs should be executed in the presence of a nurse or a paramedic. Drugs are not permitted to be given on hands. And last principle of treatment, free of charge treatment for patients. A treatment must be free of charge because the cost of treatment of one infected patient with resistant tuberculosis is from 700,000 to 1.5 million rubles. It's very, very expensive treatment. What methods of treatment of tuberculosis we used? First, specific TB therapy or specific chemotherapy. Treatment of anti-TB drugs side effects. Next method, local or organ therapy. For example, inhalation, instillation, intrapleural administration, etc. Next method, collapse therapy treatment. Next, surgical methods of treatment. Also, we use treatment of complications, treatment of contaminant diseases, and health resort treatment. For rehabilitation of patients. First method, etiologic TB therapy. Etiologic anti-TB therapy is the main tuberculosis treatment, as only anti-TB drugs effect on Mycobacterium of tuberculosis. This is the main method of treatment of tuberculosis. Populations of mycobacteria in the human body, Mycobacteria of tuberculosis. There are 4 populations of mycobacteria in the human body. First population, metabolically active. These mycobacteriums can multiply in organism and spread in different organs. Next population, named phagocytosed with macrophages. Next population, inactive or dosing or persistent, but with spontaneous bursts of activity. And last population, name dormant or slowly dying. On this photo, you can see Mycobacterium of tuberculosis in macrophages. Populations of mycobacteria over time. During infection, prevail Mycobacterium of tuberculosis is phagocytosed with macrophages. Later, inactive Mycobacterium of tuberculosis or dormancy or persistent, spontaneous bursts of activity appear. And during the development of disease, metabolically active mycobacteriums prevail. Non-phagocytosed mycobacteriums are in cavitary formations. The dominant ones are intensively breeding in extracellular inflammatory fluid. Therefore, treatment of TB patients divided on 2 stages. Stage 1, or other name, intensive phase. This is destruction of metabolically active and phagocytosed or by macrophages mycobacteriums of tuberculosis. That is the conversion of the smear from positive to negative. That's why if before treatment patient was bacteria excreter, after first stage this patient must stop bacteria excretion. Second stage or supporting phase, destruction of inactive Mycobacterium of tuberculosis and relocating them to dormant form. The purpose is to consolidate the treatment effect and to prevent the development of TB relapse. In this period, patients can get treatment in ambulance, in polyclinics. And there are three groups of anti-tuberculose drugs, or three lines. First line drugs, or main drugs, isoniazid, abbreviation H, rifampicin, abbreviation R, pyrazinamide, Z, ethambutol, E, and streptomycin, S. Only 5 drugs in this group. This is the main drug, I repeat, for treatment of TB patients. This is the most active drugs for killing of mycobacterium. Next group of drugs, reserve drugs. This is aminoglycosides, kanamycin and amikacin, and capreomycin. This is fluoroquinolones, for example, ofloxacin, levofloxacin, moxifloxacin, gatifloxacin, etc. And other drugs of this group, protonamide, ethionamide, cycloserine, cerizidone, para-amino acid, and bedaquiline. This is drugs of second line. And third group of drugs, anti-TB drugs, are used for special clinical cases. This is antibiotics of wide spectrum of action and new anti-tuberculose drugs. Clarithromycin, amoxiclav, meropenem, imipenem with cystatin, and linezolide, new anti-TB drugs. These drugs were used for treatment, very rare, only for special clinical cases. And there are 5 regimes of chemotherapy for TB patients. First mode of chemotherapy is given to patients suffering from tuberculosis, separated and stored drug sensitivity of Mycobacterium of tuberculosis, except sick from contact with a patient with tuberculosis multi-drug resistant TB, patients with relapse of tuberculosis, and other retreatment cases. to obtain the data of drug sensitivity tests. Usually, this regime of chemotherapy used for treatment of first-time revealed patients with large forms of tuberculosis, for example, affection of both lungs, for patients with bacteria expectoration, and for patients with formation with destruction of lung tissue. And for this patient, treatment in first phase dured 2 or 3 months, and in this period we used 4 or 5 anti-tubercular drugs of first line: isoniazid, rifampicin, pyrazinamide, and ethambutol. And fifth drug, streptomycin. First phase shorter than second phase, but we used maximum anti-tubercular drugs. Next period of treatment for this category of patients: 4 months with 2 drugs, isoniazid and rifampicin. Next regime of chemotherapy. Second regime of chemotherapy administered to patients suffering from tuberculosis with the known mono and polyresistant to mycobacteria, with the exception of resistance to the combination of isoniazid with rifampicin. For example, resistance to isoniazid and ethambutol, or resistant to isoniazid and fluoroquinolone. This is polyresistance. Monoresistance is resistant to only one drug, except rifampicin. Polyresistant, resistance to 2 or more drugs, except combination of isoniazid and rifampicin. And for these patients, the intensive phase, first phase, 3 months with 5 drugs. We used kanamycin, rifampicin, pyrazinamide, ethambutol, and fluoroquinolone or protonamide or etianamide. In second phase, used the same drugs except kanamycin during 6 months. Third regime of chemotherapy is given to patients suffering from tuberculosis without bacterial discharge with stored drug sensitivity of Mycobacterium of tuberculosis, except for patients who are reliably in contact with patient with tuberculosis multi-drug resistant TB. And the intensive phase for these patients, 2 or 3 months with 4 drugs of first line. And the continuation phase, second phase, 4 months with 2 drugs only, isoniazid and rifampicin. Fourth The fourth regime of chemotherapy is given to patients suffering from drug-resistant tuberculosis, rifampicin and isoniazid, or rifampicin only, as well as patients who are reliably in contact with a patient with tuberculosis multi-drug resistant TB. And treatment of this category of patients, more long time. First phase, the intensive phase, during 8 months, and use drugs of second line. Must be combination of 6 drugs during 8 months. And the second phase for this patient from 20 to 18 months without injection drug. 5 drugs used: pyrazinamide, fluoroquinolone, prosinamide or athionamide, cycloserine, and para-aminosalicylate acid. And last, the fifth, the mode of chemotherapy is given to patients suffering from drug-resistant tuberculosis, rifampicin, isoniazid, fluoroquinolones, and one of the aminoglycosides or capreomycin. Simultaneously, patients with extensively drug-resistant XDR TB. And treatment for this category of patients, in first phase, 8 months with 7 drugs, and second period, second phase, from 20 to 18 months, 6 drugs without injection drug, injected drug. And all anti-tuberculose drugs have side effects. All side effects divided on 3 groups. First, light. You don't need the advice of specialized. Second group, medium. Consultation of a specialized is required when changing the dose or changing the drug. And third group of side effects, severe, need immediate hospitalization and or required for consultation of a specialized. What are the side effects of anti-tuberculose drugs? All anti-tubercular drugs have complications of the gastrointestinal. That's why all anti-tubercular drugs are hepatotoxic. Peripheral polyneuropathy. This is characteristic for isoniazid, cycloserine, linezolide. Convulsions, also isoniazid, cycloserine, linezolide. Mental disorders, isoniazid, cycloserine, protinamide, and athionamide. Next side effect, hearing loss. This is typical for aminoglycosides and capreomycin. That's why for injected drugs. Kidney failure, also injected drugs. Arthralgia, typical for pyrazinamide, fluoroquinolones, and bedaquiline. And retrobulbar neuritis, correctly for ethambutol and linezolid. Next method of treatment, local therapy. We used inhalation in this case, therapeutic bronchoscopy, instillation, lavage, sinus tracts. Next method of treatment, collapse therapy treatment. Collapse therapy divided on two methods, pneumoperitoneum and artificial pneumothorax. Pneumoperitoneum is the introduction of air into the abdominal cavity, and artificial pneumothorax, the introduction of air into the pleural cavity. This method used for create conditions for the convergence of the walls of the cavity, for immobilization of lung, for accelerate the regeneration through the creation of relative rest of the lungs. And for stop of dissemination of mycobacteriums by blood, by lymph, used also. And this method used after operation for immobilization of the lungs. Next methods of treatment, surgical treatments. Used many types of operation. For example, segmentectomy, when resected one segment of the lung. Lobectomy, this is resection of one lobe of lung. Or bilobectomy, when resected two lobes of the lung, right lung. Combined resection, when resected one lobe, for example, and one segment of other lobe. And pneumonectomy, resection of all lung. Next operation, pleurectomy. This is removal from pleural sheaths, purulent contents. For example, this method used at empyema. Next method of surgical treatment, thoracoplasty. This is removal part of the rib frame. Usually resected from 5 to 7 ribs. Next method of treatment of TB patients, health resort treatment. This method used in supporting phase of chemotherapy for effective monitoring of treatment, used for recovery of function of the affected organ, and for general rehabilitation. In Crimea, there are some sanatorium for treatment of TB patients. Санаторий Старый Крым, Sanatorium Семиис, Sanatorium Dolossi, and Sanatorium Юность for treatment of children and teenagers. Why the results of treatment of tuberculosis is still unsatisfactory? The problem is not so much in treatment, but more in monitoring its implementation. That's why must be control of treatment. Practice shows that the majority of patients quit anti-tuberculosis treatment on their own will. The anti-TB drug intake needs to be controlled. Why the process of treatment needs to be controlled? A tuberculosis patient does not consider himself to be ill, does not want to be treated, and most often behaves as though he or she is healthy. The patient does not have an incentive to take treatment, or they are poorly expressed. TB patient gets used to the symptoms and does not pay attention to them. What methods for control treatment? A ban on the sale of TB drugs in the pharmacy network. Next, free issue of TB drugs. Next, receiving TB drugs only in the presence of a paramedic, in the polyclinic of the clinic, the office of control treatment, clinics, or at home. Next part of our lecture, preventive measures for end of treatment. Health education with patients, conversation with patients about the need for the full course of therapy, interviews with relatives of the patient, and visual health campaign in UT patients. That's why we should work with patients all period of treatment, from beginning to finish of treatment. Next measures. Organizing food baskets for the sick, the daily cost of TB drugs in clinic, administration areas, businessmen, religious organizations, parties, and members of different parties. Payment of issuance of travel tickets to the patient to travel to the clinic. and organization in hospitals catering for outpatients undergoing treatment. And preventive measures against tuberculosis, prophylaxis of TB. Next part. World statistics shows that 5 to 10% of people infected with tuberculosis will definitely fall ill with it. If there is no source of tuberculosis infection, people who discharge bacteria, will people be infected with tuberculosis? How do you think? If people are not infected with Mycobacterium of tuberculosis, will these 5–10% fall ill of tuberculosis? The source of Mycobacterium of tuberculosis is a person suffering from an active form of tuberculosis. The main objective of physiology is to block the spread of tuberculosis infection. A person who discharges bacteria must be isolated for prevention of infection in healthy people. If people are not infected, a tuberculosis is not formed. But if healthy people will infected, we can get a tuberculosis patient, and tuberculosis is formed in a patient. The objective of the TB program is to prevent human infection. Preventive measures against tuberculosis includes 3 components. First component, social preventive measures. Activities aimed at improving social conditions of people's life. It is held by the government. Next component, sanitation. Activities held by TB services and sanitary and anti-epidemic station. And third component, specific preventive measures organized by pediatricians and other specialists. And more detail about each method. Social preventive measures, activities aimed at improving social conditions of people's lives. Political and economic stability of the country, absence of military conflicts. Decent wages, effective fight against crime, illegal migration, registration of refugees. Fight against alcoholism and drug addiction, and effective health system. Early detection, descent, financing of family physicians, laboratories and X-ray offices aimed at and detecting tuberculosis. Training doctors' professional skills. Hospitalization and outpatient treatment. Provision of tuberculosis dispensaries, clinics and TB cabinets, health centers with medicines, modern medical, diagnostic and therapeutic equipment. Creating comfortable living conditions for patients. Training highly qualified specialists. It's very important for prevention of TB. Next, sanitation. Sputum specimen for Mycobacterium of tuberculosis analysis is carried out only at specified places of specimen collection. Hospitalization. Patients is out carried only to profile departments. The flow of patients are separated and do not overlap. TB offices should be equipped with combined extract and input ventilation. Disinfection of indoor air by using ultraviolet lamps. According to the schedule is current, periodic and final disinfection. The sputum of patients is collected in individual containers and disinfected by the disinfectant solution. Individual protective equipment. Medical staff work in respirators in the departments where patients with Mycobacterium of tuberculosis positive are treated. Sick people who came for an appointment in health center for the first time wear protective masks. Should wear masks. Next type of prophylactic measures, specific protective measures, divided on primary hemoprophylaxis and secondary hemoprophylaxis. Primary hemoprophylaxis is performed to people uninfected with TB but who had contact with the ones infected with HIV or tuberculosis. For primary chemoprophylaxis, used isoniazid for 6 months. Secondary chemoprophylaxis is performed to people infected with tuberculosis. Conversion of tubercular tests by children. For this chemoprophylaxis, used isoniazid for 6 months also, or isoniazid with pyrazinamide or ethambutol for 3 months. That's why one drug during one the main drug during 6 months or 2 drugs during 3 months. Next variant of specific prophylaxis, vaccination and revaccination. The BCG vaccine possesses a high preventive action. Vaccinated child is protected from almost all forms of generalized or complicated tuberculosis. For example, disseminated tuberculosis, tuberculous meningitis, which without treatment often have a fatal outcome. Immunization reduces the incidence of TB to 7-10 times and the infection to 1.5 to 3 times. BCG vaccine was obtained by Calmette and Gerin in 1919. They possessed expressed immunogenic qualities. It consists of tuberculosis vaccine dry for intradermal injection, tuberculosis vaccine BCG-M dry for sparing immunization. To implement a vaccination, dry vaccine should be diluted with isotonic solution of sodium chloride. Diluted vaccine must be immediately used as intended. Vaccination dose contains 0.05 milligram in 0.1 milliliter solvent. The BCG vaccine is injected on a 3rd, 6th day of a child's life intradermally in the shoulder area on the border of upper and middle thirds, forming a papilla with a diameter of 5-6 millimeters, which disappears in 15-20 minutes. The place of reaction should be protected from mechanical irritation, especially from water. After 4-6 weeks, vaccination takes the form of infiltration with a diameter of 5-10 millimeters with a knot in the center. Within 2-4 months, a scar of a round shape with the diameter of 2-10 millimeters. It's normal reaction. Vaccine-induced immunity develops within 6 to 8 weeks. Contraindications to vaccination. Prematurity of 2-4 level with body weight less than 2.5 kilograms get birth. Second, vaccination is postponed in case of acute diseases and extra exacerbations of chronic diseases. Intrauterine infection, septic disease, hemolytic disease of a newborn in moderate and severe forms. Disorders of nervous system with severe neurological symptoms, generalized skin lesions, etc. Until clinical manifestations of a disease disappear. Third, contraindication, immunodeficiency, primary. Fourth, generalized BCG infection detected in other children of the family. And fifth, contraindication, HIV infection in mother. Children who have not been vaccinated in the first days of their lives are vaccinated during the first 2 months in a health care center or other medical institution without prior tuberculin diagnostics. Children of 2 months and upwards should take a PPD vaccine, a PPD test before vaccination. Children with negative reaction to tuberculin are vaccinated. Revaccination. Children aged from 7 to 14 years with a negative reaction to a PPD test should be revaccinated. Precautions to vaccination. First, acute, infectious and non-communicable diseases, exacerbation of chronic diseases, including allergic ones. Patients are vaccinated in 1 month after recovery of remission. Second, immunodeficiency, malignant tumors, or any localization. Then is assigning immunosuppressive drugs and radiation therapy. Vaccination is held not earlier than 6 months after the end of treatment. Third, tuberculosis, Mycobacterium of tuberculosis in history. Positive and doubtful PPD test. And fifth, complicated reaction to a previous vaccine BCG, keloid scar, lymphadenitis, etc. Educative activities, training of patient, daily intake of anti-TB drugs is necessary. It is necessary to conduct a full course of TB treatment. It is necessary to take preventive measures of tuberculosis infection of relatives, children, grandchildren, and the use of personal protective equipment. Training relatives of the patient control over patient's daily anti-TB drugs intake. Creating conditions for the full TB therapy. Observation of rules of personal hygiene for preventing the spread of TB infection from the patient. Teaching people. People should make yearly chest X-rays. In case of coughing more than 3 weeks, visit a doctor. Tuberculosis is curable and TB treatment is free. All this information patient must know to know. Methods of teaching. This is method of teaching the population, specialized performance in the media, creation of scientific documentaries. Other methods of teaching the population. Information on billboards, banners, posters, brochures. Other methods of teaching the population. Educational work with students. On this photo you can see the contests of wall newspapers in the Medical Lyceum in Crimea Medical Institute Academy, Medical Academy. Thank you for your attention. See you next time.